Call for Action presents Of Consuming Interest, a public service show that discusses scams, deceptive offers, and other consumer concerns. Here's Call for Action's president and your host, Shirley Rooker.
Oh, my aching back is an all too familiar refrain. Where do you go for help? Well, how about a chiropractor? But traditional chiropractic is much more than just treating aches and pains. Its real purpose is to help you reach your greatest health potential. How does the chiropractic approach differ from traditional medicine? Well, you're about to find out. Because here to answer these questions is Dr. Brad Wolfe. Dr. Wolfe, welcome to Of Consuming Interest.
Thank you, Shirley.
Now, chiropractic. Let's talk about what this tradition is, and I gather it has a very long history. This is not something that's just modern day medicine. This goes back how many years?
Well, actually, the care of the spine goes back for thousands of years. There's evidence that the Egyptians, that the Babylonians, there are several cultures throughout the world, the Chinese, have used the spine as a means to allow greater health potential. But it hasn't been until the last 100 years, or actually 104 years to be exact, that chiropractic has come into play.
Now, when I said in the introduction that it's more than just treating aches and pains, I think many of us think of the chiropractor as the person that we would go to if we're having a back problem or our neck's bothering us and we want to try something other than just mainstream medicine or perhaps surgery. But from what I gather and looking at your literature, that is absolutely the wrong concept of what you would call traditional chiropractic.
Yes. So you have to understand that chiropractic, the very first chiropractic patient was deaf and got his hearing back. And back in the very beginning, it was thought that maybe the chiropractic was a treatment for deafness. But what it turns out, and what we've realized over the course of the 100 years, is that chiropractic is about releasing the life and the energy in the body, which manifests information to all the cells in your body.
And you do that by how? By manipulating?
Well, actually, the focus is on the spine. And in order to understand the way that the body works and the health of the body, you have to understand that that all functions within your body, information going to your heart, going to your lungs, to all your organs, is reliant upon your nerve system. And your nerves are responsible for controlling and coordinating all functions. So the reason why chiropractors focus on the spine is because the spine houses the main branches from your brain, which is your spinal cord. And if you want to understand the relationship to the nerve system, look at Christopher Reeve, for example. He had an accident where he fractured the bones in his spine. It began to interfere with the nerve signals going from his brain to his body. He doesn't have back pain. He breathes on a ventilator. He has trouble with his bowels. He can't move his legs, and on and on.
But because that's interrupted the flow from the brain to the rest of the body via the spine.
Exactly.
So it shuts down if the flow is interrupted, which is what you're telling me.
Right. So what chiropractors do is we detect what are called vertebral subluxations. Very simply what that means is when there are misalignments or the bones are not in a healthy position, it begins to interfere with the nerve energy that's flowing from the brain to the body.
And we Americans, it seems like that millions, tens of millions of people actually have back pain that's manifest in many ways. It can be pain in the back or it can be pain in the legs.
Sure.
We're going to get to that, but let's just talk a little bit more about what kind of training do you receive to get you're called a doctor of chiropractic, which is a DC. What does that entail?
Okay. A lot of we do undergraduate work wherever we happen to do our undergraduate work. The pre-qualifications for chiropractic school are the same for veterinarians, for nurses, for medical doctors, for chiropractors, for PTs, is all the same prerequisites. Where it changes is when you go into chiropractic school. It is probably similar for the first few years. You do basic science studies, biochemistry, pathology, physiology, anatomy, etc., where you're learning the basics about the way that the body functions. The difference from there is that chiropractors study the spine and the nerve system. That's our main focus. Medical doctors would study drugs and surgery or whatever other procedures. Physical therapists would study rehab techniques, etc.
So you actually, how many years of study do you go through after you graduated from college?
From undergraduate degree, there is approximately 5.5 years.
So you have some intensive training, and you do a residency program as part of that, I assume.
That is a part of the program as well, yes.
Now, when you do a residency program, where would you go? We think of doctors who go into hospitals. Where would you go as becoming a chiropractor?
We do a tremendous amount of work. In fact, we do hands-on work from the very first semester that we're in school. So we're literally working on the spine from day one. From there, what happens is we go through clinic rotations. We learn about the spine. We get our hands on student spines. We go through a whole process of learning how to adjust and how to analyze the body for subluxations. After that, what happens is if you complete all your requirements, then what happens, and what we ended up doing, my wife and I, we both are chiropractors, is we went out into the field and we went to chiropractors' offices, and we spent some time there doing that.
So that's how you become, serving as an internship with a practicing chiropractor.
Exactly, because
okay.
There's no better way to learn chiropractic than to go to somebody's office who's actually doing it.
What does the word chiro mean? Does that refer to spine? Is that the Latin word for spine?
Chiropractic actually means done by hand.
Chiro meaning C-H-I-R-O, the first
meaning
part of it.
hand,
and then
practice, the practice of.
Practice by using hands. Well,
Yes.
that's interesting. I never knew that. Now I know where it comes from. All right, so your concept is that you're doing something that's going to affect the body, not just the pain that's there, but you treat the whole body. So if someone comes to you, now let's walk me through this since I've been having a back problem.
Okay.
With a manifesting itself in my right leg, and I've been doing some physical therapy and working out with a personal trainer trying to get some relief here, and it's helping. If I came to you, what would you do? I mean, I'm sure there's a lot of people sitting out there saying, oh, I can identify with that. What would you do with me?
Okay.
Well, maybe I shouldn't ask you that. What would you do with a patient? We'll keep this show straight.
Chiropractic is especially the way that we do it in our office, is very different than most people think. The first thing you need to understand is that the goal is not to treat the pain. See, pain and symptoms are good. They may not feel good, but they actually are good. And the reason why they're good is because if you stick your hand on a hot stove and you burn yourself, that's a good thing, right? It may not feel good, but it's your body signaling to you that there's a problem. So pain in your body is a signal that there's a problem. We don't want to eliminate it. We want to get to the root cause of the problem, remove the interference, and the inborn intelligence, or what chiropractors call the innate intelligence within the body to do the healing. So what we would do with you is we would first do an exam, find out where the problems are, find out the severity of the problems. We run some nerve tests in our office. We do several other tests to analyze the spine, the positioning of the spine, look at your posture, look at the way that you use your body in your workplace. And then we would put you on a course of care, which would move you forward from where you are now and begin to gradually improve the quality of your spine so that it improves the health of your body.
I see. So, and that could be exercises, manipulation, a variety of things.
What we do in our office, we do give some things for people to do outside of the office, but the main focus is on what's called the chiropractic adjustment. Manipulation is very different than adjustment. The purpose of adjustment is we provide some input into the body. It's very gentle.
Okay, before we continue there, let's just take a brief pause.
Okay.
If you've just joined us, you're listening to Of Consuming Interest. I'm Shirley Rooker. My guest is Dr. Brad Wolfe. He is a chiropractor, and we're talking about the traditional form of chiropractic, which is more than just pain and aches. It's treating your whole body. Before we took a break, Dr. Wolfe, you were talking about the difference between manipulation and adjustment.
Yes.
Define that a little more for us, please.
Okay. The connotation of manipulation is that you are forcing something to occur. It's used in a lot of different contexts, manipulating pencils or whatever it may be. Adjustment is what the body does on the inside. Okay, so if I give you and chiropractors use this interchangeably to the chiropractic adjustment, the adjustment is actually what happens to you. So we do what we do to you, and then on the inside, your bones begin to shift, the tissues begin to shift, and that's where the power in the adjustment really occurs.
Now you've got here, our listeners can't see it, but we'll tell them what you've got. You've got a mock-up of the spine. Is that correct?
We call him Seymour Bones, or for the
Seymour
females,
Bones.
it's Ophelia Bones. There you go.
Ophelia or Seymour Bones. Okay. Very interesting looking gadget there with all these little sharp pointy things coming out of it, which I gather are what? Is that nerve endings that are running through the spine?
Actually, these yellow things here, I know you can't see it here, but there are 24 movable bones in the spine. And then you have a bone at the base of the spine called the sacrum, which forms the foundation of the spine. And then at the very end of that is the coccyx, or what people call the tailbone. What you're seeing here coming out of the middle of here are branches off of the spinal cord which provide information to the body. They're obviously much longer than you can see here,
Right.
but this is the very beginning of them.
So those are the things that can create a problem if we've gotten a spinal cord that's out of alignment?
Well, there's actually...
That's too simple an answer.
Yeah, I
That's
mean,
too
it's
simple. Okay.
much more complicated than that. But in order to understand it more thoroughly, you have to realize that there's a relationship between structure and function, right? If the structure of the bones are out of alignment and it begins to interfere with those nerves, then it's going to interfere with the natural flow of nerve energy through your body. Sometimes the spinal cord can actually get twisted. Sometimes it's the bones that get twisted. And that's part of the analysis of chiropractic to correct those problems.
Well, I got my problem from sitting on a flight, an airplane to Africa, which I guess I didn't move around enough or something. I don't know. Is that unusual?
I
Hard
think
to say. I probably had something going on before then that contributed to it. Right.
Exactly.
Okay.
What I would say to that is somebody goes throughout their life, literally from as a child, they're learning to walk. They may fall hundreds of times. They're sitting in a chair when they're in school. They may be sleeping on a mattress that's unhealthy, a pillow. Then they start to go do sports. Maybe they're doing ballet or dancing, or maybe they're playing football. They're getting knocked around, and in the process, little misalignments occur. If the body is able to compensate to those misalignments, then the body is able to go on its way. But what happens is when the body is not able to correct it, that's when the problems occur.
And that can be from anything, couldn't it?
It can be from many things, and not only that, you may not feel it. In fact, subluxations very often are very silent. You don't feel them occurring. Very much like if you have a cavity, in the very beginning stages of a cavity, you start to get some wearing down of the enamel. It's going into the tooth, but it hasn't yet hit the nerve root. So you aren't even aware that the problem is there.
And only when it gets into the nerves, as in the back or the tooth, that you begin to experience the pain.
By the time somebody experiences pain, there has been a tremendous amount of damage on the spine. That doesn't mean that it can't be corrected. It just means that the problem has been there for a much longer period of time, unless there's been traumatic situations. Somebody was in a car accident, they fell on their head, then there's literally instantaneous feedback that there's a problem in the body.
That's very different. Now tell us, so what does it encompass when you talk about it's looking at the whole wellness, the greater health potential? How do you arrive at this? I mean, what techniques are you using besides the adjustment process that you've talked about? What else are you looking at that's going on in a person's life as part of your treating them as a patient?
That's kind of a complicated question. But
No.
if I was to, what I would say is, because the focus of what we do as chiropractors is to correct misalignments in the bones, that does in and of itself affect your entire body. Literally every piece of information that's going anywhere in your body has to travel through your spine first. There are a few exceptions. That there are things that you can do on your own in order to improve the quality of your health, but the focus of what we do in the office is the chiropractic adjustment. The remainder is teaching people about lifestyle, such as not crimping the foam between their ear and their shoulder, not crossing your legs, take the wallet out of your back pocket, get a new pillow, get a mattress that is healthy for your spine. Sit in a good chair. There are people that sit in chairs for 8, 10, 12, 14 hours a day, and they're sitting in a chair that's not supporting their spine.
So all of those things, and then of course I'm making an assumption here, but is an exercise program a part of this?
It's not a replacement for chiropractic. In fact, they're two completely different things. There is a need for several aspects in order to achieve optimum health. Obviously, you need good foods. You need good water. You need good oxygen. You need to rest. You need to have a good mental attitude. And you need to have a clear nerve supply to your cells. So it's not a replacement for one of those things. It's actually in addition to, in order to achieve your maximum performance.
Yes, I didn't mean it as a replacement, but
Sure,
it seemed
of
to me
course.
when you were talking about people with not supporting their spines that the muscles also help support the body. So if the muscles are stronger, they're going to help support and alleviate some problems. It just seems to me reasonable, maybe not, I don't know.
My experience actually shows that people who have misalignments in the spine can actually do more damage than good if they're exercising. If you're exercising on a spine that's out of alignment, you're putting abnormal stress on different aspects of the spine, which is going to interfere with that life in your body. Now, if you have a spine like myself, I've been under chiropractic care for close to 12 years now. I do regular exercise, not as a means for anything other than just continuing to strengthen the core of my body, continuing to become stronger from the inside.
Is that how you got interested in chiropractic medicine? Chiropractic, it's
Yeah.
redundant to say medicine, right?
Yes. How I got into chiropractic is I had gone to massage school several years ago, and I got to a point where I was frustrated at not getting more permanent changes. Massage is a fantastic profession that does wonderful things for people, and I still go on a regular basis. And I actually was going to school with somebody who had a friend who was a chiropractor, and that's how I got introduced to chiropractic. And over the course of time, I started going regularly. I didn't have any aches or pains. And what I started to notice is I didn't have, my allergy problems were not as severe. I didn't have sinus problems anymore. My breathing got easier. The performance of my body got easier. I started thinking clearer. That's what I started noticing.
It started making your whole body function more effectively.
Right.
Let's just take a brief pause. If you've just joined us, you're listening to Of Consuming Interest. I'm Shirley Rooker. My guest is Dr. Brad Wolfe, and we're talking about chiropractic, and we're talking about how the practice is devoted to the total body, not just treating aches and pains. That's the first part of it. That's what we achieve, but it also has to do with more with total health. Well, when you counsel people in your office, do you look at them? You had mentioned earlier that you look at lifestyle changes, such as the wallet and the pocket and that sort of thing. Is diet a part of your practice? Or do you work with a nutritionist, or is that just something that you tell people they need to look into, or is that a part of it?
I think it's very important for people to look into foods. Every week there's a new diet fad. There's a new thought on food. Eat this food, and then the next week they'll come back and they'll say, don't eat that food. If you say to somebody, how much water should you drink? Somebody may say 8 glasses. Well, who needs 8 glasses? Do you need 8 glasses? Do I need 8 glasses? I'm probably, say, 30% larger than you are. So people's bodies are different. Does a child need as much as an adult? So from an educated standpoint, I think there are things that we can do to begin to understand foods, but every individual is different, and it's their responsibility, in my opinion, to take charge of that.
They need to find that answer for themselves.
Yes.
We mentioned mattresses earlier. Let's talk about mattresses. Is there a mattress for everybody, or for back health? Or is it soft? Is it hard? Is it air? Is it foam? Is it inner spring? What is it?
I would say the same thing that I say about food to those aspects. You need to find something that's comfortable for you. You need to lie on mattresses, sit in chairs, use pillows in order to understand your body, because your body is always signaling you. If a pillow is uncomfortable, your body will get feedback that it's not comfortable. So there's really not a clear answer to that question, because everybody's a little bit different.
But back support, if you're sitting for a long period of time, that means, what about some of those little pillows that are sold that are supposed to help for your back, and they're the ones that have not the bean bags, but they have some sort of a seed in them? Is that useful for travel, if you're traveling on an airplane or something like that, or is the pillow that's on the airplane adequate to stick behind your back?
Again, unfortunately, the environments that we're in, the chairs that we sit in, the planes that we travel on are very unhealthy for our bodies. If we can do things in order to minimize the stress in our body, but ultimately stress is a part of our lives. It's how well that our body adapts to those stresses that's going to determine the health of your body. So you have 10 people go outside. Some of them are affected by the allergens in the air. As people realize right now, the grass is being cut. Trees are in bloom, flowers in bloom. Some people are responsive to that and some people aren't. So what makes the difference? What makes the difference is the internal strength of your body and the ability of your body to adapt to those stresses and to provide the proper information and life to your cells.
And when we can't do that, we hurt.
We hurt, and it starts to compromise the very function of our body.
Right. All right, so now you said that you've been a patient of chiropractic for a long time, 12 years, 11 years, or something like that. So is this something that is an ongoing process with people who have pains and misalignments and whatever, or you don't just go in and get a quick fix and you're okay?
There is nothing in the health arena that's a quick fix. You can't do a quick diet, you can't do a quick exercise program, you can't do a quick spinal care program.
You're breaking my heart.
That doesn't mean that there aren't things that can be done very quickly in order to make a change, but a lot of that is going to be dependent upon each individual's body. Your body is going to respond different than my body. So the benefit of chiropractic wellness care, which is what we do in our office, is very much like you take care of your teeth. Would you ever not brush your teeth? Would you ever not floss? Would you ever not go for periodic checkups to make sure that your teeth are in good shape? Would you ever start an exercise program and go a month or 2 months down the road and say, okay, I'm fit, I don't need to exercise again? It doesn't make any sense. But people treat their bodies as if I don't feel that there's a problem, then everything's okay. And that is the most dangerous way to look at health.
So the first symptom may be acute pain. You will relieve the acute pain, but then there should be long-term follow-up care is what you're saying.
There may not be any acute pain. What if somebody comes into my office who's a child? We have children come in literally from newborns on. In fact, I just adjusted a 2-day-old the other day.
You're kidding.
And
what were the how did they know that it needed help?
well, I'm a friend of the families, and I've been educating them about chiropractic. What happens is literally from the time that a child is born, it is possible that the actually delivery process, the birthing process the mother goes through, puts a tremendous amount of stress on the child's spine. Now, there are ways to minimize that, but the essential nature of delivery can be very detrimental to the child's body. Now, it turns out that as children begin to get older, they may fall off a changing table. Children don't get back pain. They get colic, they get ear infections, they get asthmatic problems, etc.
And you say that all comes from the back?
If it is coming from the spine and there is a spinal alignment, many times those problems will go away.
So it could be. It's not it is, but it could be.
Exactly. So it's not the treatment for those conditions. Chiropractic is not a therapy. It's not a treatment for any one specific condition. The premise is you should have a healthy nerve system. You should have a healthy nerve supply to all your cells. If your spine is out of alignment and it is putting pressure on those nerves, and then it can affect anywhere in your body. Whether you're a children, whether you're an adult, my 91-year-old grandfather comes in to get adjusted. So it doesn't matter what age you are or what you're doing, you still can benefit from chiropractic care.
You know, we've only got about a half a minute, but some people say that chiropractic is not good medicine. I mean, you know that. Do you think that chiropractic is overcoming that image?
I think that unfortunately most people don't truly understand what chiropractic is all about. And I see on a daily basis the miracles that happen in people's lives as they regain their health again. I think it is being overcome. I think the key is education. That's why we do these shows. We're out in the community every week educating people about their spine and spinal well-being, the connection to their nerve system, and how that manifests health in their body.
Okay. Thank you so much for being with us.
You're welcome.
You've been listening to Of Consuming Interest. My guest has been Dr. Brad Wolf, and we've been discussing chiropractic. I'm Shirley Rooker with Call for Action.
Of Consuming Interest is a public service program presented by Call for Action, hosted by Shirley Rooker, produced by Laura Sauer. Call for Action is an international nonprofit network of hotlines which offer free and confidential assistance. If you have a complaint, contact Call for Action at 301-652-HELP. That's 301-652-HELP.